So we've been dispatched to a 60-year-old female complaining of chest pain and shortness of breath. Upon entry of the scene, we introduced ourselves and took some vitals. We firstly established her ABCs, which we could tell that she had a clear and patent airway by the fact that she was able to introduce herself easily and tell us her chief complaint. In terms of her breathing, she appeared well perfused. She wasn't hunched over tripoding at all. Her words per breath weren't minimal, and she wasn't cyanosed around her lips or in her hands at all. In terms of her circulation, her pulse radially was strong and regular, and she wasn't pale or clammy or diaphoretic at all. And again, she appeared relatively well perfused. In terms of what we're going to do a cardiovascular and respiratory assessment to establish what exactly is going on with her chest pain and her shortness of breath. When prioritising vitals, we did a BP first, a standing and a sitting BP to see if her position changed her readings. We also did a heart rate and a 3-lead and a 12-lead to establish whether or not there was any myocardial ischemia or any unusual rhythm that we should be concerned about. We also did a CAT refill as well as all our other vitals. In taking pulses from her arm radially, we also ensured that we did it on both arms to ensure that they correlate correctly. If they didn't, this could indicate an aortic aneurysm. Okay, so I'm here with Sarah today, and I can see she's in a little bit of pain, but she's a little bit short of breath, but she seems relatively well perfused. When I feel for her pulse, it's strong, seems relatively regular, and she doesn't appear to feel very cold. So Sarah, can you tell me a little bit about your pain? When did it start exactly?
It started when I was walking up the stairs.
Okay, how long ago was that roughly, do you know?
Maybe 20, 30 minutes ago.
Okay. Did it get worse?
Yeah.
Yeah?
Yeah, progressively worse.
So what kind of pain is it? Is it sharp, or is it like someone sitting on your chest?
Kind of like a burning pain.
Yeah, like someone sitting on your chest.
Yeah.
Quite heavy?
Yeah.
Okay. So out of a 1 to 10, how bad is it at the moment?
Like a 3.
Okay, so it's not too severe at the moment. So what's your cardiac history like? Do you have any medical issues with your heart? Do you know?
I take aspirin and GTN.
Okay. Do you know the word angina?
Might have heard of it before.
Yeah, maybe.
Sounds familiar.
Have you taken either of those today?
I've just taken my aspirin.
Aspirin this morning? Okay. Do you get this pain quite often?
Every so often.
Yeah.
Just on exercise.
Yeah.
Sometimes, yeah.
So you haven't had it today before at all?
No.
You haven't taken any GTN for
No.
it? Okay. Does it radiate at all?
Yeah, it goes down my arm a bit.
Yeah. Is it severe or not too bad?
It's so uncomfortable.
Yeah, so it's just kind of annoying. And when you move around, does it make it worse?
No.
No, it just kind of stays the same.
It
Constant.
stays the same.
So I'm also just going to quickly check for any pitting edema, which would indicate any heart failure, which I can't actually see anything, and it's not swollen. It just rebounds when I press on it, which would indicate that she hasn't got any. So when doing a assessment, you also want to palpate the abdomen just to check for any abnormalities around the aorta, any lumps, any masses, and check to see if you can actually feel. So is it okay if I lift your shirt up?
Yes.
Your abdomen? Okay. So you just want to use your hand and just push across. Feel if you can feel anything unusual. So it feels like it's all pretty the same. Can't feel any lumps. And then if you just feel above that belly button, you can kind of feel the aorta pulsating. Cool. Also, just quickly looking at the hands. Sorry, Sarah. You can't see any clubbing, or they're not tied, so obviously she doesn't smoke, which indicates that she probably doesn't have cord or heart failure, which the hypoxia causes the ends of the fingers to become really swollen. And you can also see from Sarah's face that she doesn't have any cyanosing around her mouth or in her hands there. So Sarah here is also experiencing a little bit of shortness of breath, which is probably indicative of the chest pain, which is likely to be angina. But we're just going to do a quick respiratory assessment just to rule out any other underlying medical issues that might be happening. So Sarah, I'll just ask you a few questions first. I'm just going to make them quite short, closed questions, just because we don't want to make her exert more than she needs to. So Sarah, do you smoke at all?
No.
Have you been sick at all lately?
No.
No? You don't have any respiratory issues?
No.
No medical history of lung conditions or anything?
No.
You don't have asthma?
No.
You don't have any COPD, nothing like that?
No.
You don't get bronchitis or emphysema or anything?
No.
Okay. Have you been sick at all recently?
No.
Okay. And did this shortness of breath come on at the same time as the pain?
Yeah.
So Sarah can rule out likelihood of asthma and COPD. She doesn't have a medical history of this. And she also hasn't been sick recently, which would indicate she probably doesn't have like pneumonia or anything. But we're just going to check her lungs anyway, just to check that there's no crackles or wheezes or anything. So we're just going to auscultate the lungs, so starting at the top. Take a big deep breath in for me, Sarah. And on the other side. Breathe, deep breath. Yeah, perfect. And again. And again. I'm just going to pop under your shirt for a second. Breathe in. No, it's the other side, sorry. Breathe in. Breathe in. Okay. We're just going to go on the back as well. So I'm just going to pop under your shirt, okay? Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. So I can't hear any I can't hear any wheezes or crackles. Upon examination of our patient, we can see that she had a GCS of 15. This was indicated by the fact that she was able to spontaneously open her eyes and look at us. Verbally, she was able to spontaneously answer questions and speak freely. And in terms of motor, she was able to obey commands. When I asked her to roll her shoulders, she was quite easily able to do that, giving her respective scores of 4, 5, and 6 for a total of 15. In terms of what we found that she had quite serious retrosternal pain, which had subsided upon sitting down, and it was brought on by exercise, and it was quite progressive. The exercise is associated with angina, most likely. Angina is indicated as being progressive and retrosternal, and it's brought on by increase in activity. She also had a little bit of shortness of breath, which is also associated with angina. And while she had a cardiac history that she didn't quite understand, we could likely gather from her medications of aspirin and GTN that it was associated with the angina. In terms of the rest of our assessment, we found that she upon auscultation, she had clear lung sounds, so she didn't have any expiratory wheezes, bubbles, crackles, or pops in her lungs, which can be associated with pulmonary edema, which is associated with heart failure, or any chest infections, and she hadn't said that she'd been sick lately, so it's likely not the cause of her shortness of breath. And we also did a pedal examination to check for any pedal edema or any pitting edema. Her ankles weren't swollen at all, which indicates that which is also indicated for heart failure, and she didn't have any of these symptoms. We also checked her fingers for any clubbing, which is associated with COPD causing hypoxia or any heart disease. And she also said that she didn't have a history of any respiratory conditions. She didn't have any COPD or any asthma or any other respiratory complaints. And she, upon palpation of her abdomen, we couldn't feel any abnormal masses or lumps that could be associated with the aorta, and we found the aortic pulse, which was quite strong and quite regular, so that likely negates the possibility, I mean it's not complete, but of aortic aneurysm. So with her angina, like she said, it's not all the time, and it is brought on by exercise. So this indicates possibly giving her some GTN, so 0.4 milligrams for myocardial ischemia. And if so, we will monitor to see if the pain dissipates at all, and also take another full set of vitals, including 12 lead blood pressure, heart rate, and all the others, just to monitor what's going on for her, and if not, possibly taking her up to hospital just to get her checked out and rule out any other possible issues going on.